Good afternoon. My name is Mercedes Hardy. I will be the nurse practitioner student performing your head to toe exam today. Can you tell me your name?
Deborah Ann Sanders.
And how old are you?
48.
Okay. So during your exam, I'm going to be looking at your skin. I'm going to be assessing your color, your skin trigger, temperature. It's looking for any redness, scars, lesions, nevi. Just looking at your face and your neck, it looks like I don't notice any abnormalities. I'm going to go ahead and feel of your scalp. I don't feel any masses or depressions. I'm looking at your hair color, your hair distribution. Did you have any tenderness that was noted? Good. Okay, I'm going to go ahead and feel of your temporal arteries. Those are both 2+. And then I'm going to feel of your master muscle. I'm going to have you clench your jaw, move it side to side, and that's just testing cranial nerve 5. The next thing I'm going to look at or feel up is your lymph nodes, your preauricular, postauricular, tonsillar, submandibular, submental, cervical, and subclavicular. And I didn't feel anything abnormal there. Did you have any tenderness?
No.
Good. The next thing I'm going to have you do is puff out your cheeks and smile for me. Good. And then raise your eyebrows. And that's just testing cranial nerve 7. And everything looked symmetric and equal. The next thing I'm going to have you do is I'm going to look at your ears. And they look like they are good, equal, no masses noted. Any tenderness, I'm going to go ahead and look in your ears. Pull the pin back. And I'm looking for a red reflex at 5 and 7. And your tympanic membranes are pearly gray. The next thing I'm going to do is I'm going to test your hearing. So if you could occlude one ear and then repeat after me.
ABC.
And on this side.
1, 2, 3.
And then that was the whisper test, and then I'm gonna perform the Ryan test. So if you could just tell me when you're not hearing this anymore.
Okay. 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 Okay.
And that just tests for air conduction is greater than bone conduction. Now I'm gonna perform the Weber test, and this is gonna test for lateralization. So tell me if you can hear this on both sides. Is it equal on both sides?
Yeah.
Okay. And then I'm going to test for, the next thing I'm going to look at is your eyes. So I'm going to be looking at the conjunctiva of your eyes and your sclera. And your conjunctiva is pink and your sclera is white. Was there any tenderness noted underneath your eyes? Okay, good. I'm also going to be looking at your vision, and I'm going to look at your pupils. So I'm going to look at the light, and I'm going to look at how your pupils react to light. So if you'll look straight at me. And they're both round, equal, reacted to light. Now I'm going to get you to look at this straight, and then look behind me at the wall. And then look at this again, and I'm gonna bring it on in, and then look behind me at the wall. Look at this again. Okay, good. That makes you a little dizzy. And then I'm gonna go ahead and I'm gonna look at cranial nerve 2 and test your vision. So if you can cover one eye and go ahead and read the smallest line that you can.
LTFPH.
And then cover it again.
LTFPH.
Good. And so that was doing cranial nerve 2, cranial nerve 3 and 6. I'm going to go ahead and test, if you'll follow my finger. So just with your eyes. There you go. Okay, good. And then I'm going to check your peripheral vision as well, okay? So then let me know when you can see my fingers.
Okay. Okay.
Okay. And then I'm going to go ahead and look at the red reflex in your eyes as well. Okay. And then I'm going to look at your nose. So if you can occlude one side, breathe, and occlude the other side and breathe. And everything looks midline and symmetric with your nose. I'm going to also palpate your sinuses. So palpate the frontal and maxillary sinuses. And then the next thing I'm going to do is I'm going to look in your mouth. So if you can smile for me, I'm going to look at your teeth. And now I'm going to look inside of your mouth and look at your tonsils. And it looks like your tonsils are pretty small. 1+, I would say. Can you stick your tongue out for me? Move it side to side. Okay, good. And go ahead and say "ah" for me. Okay, good. So I was testing cranial nerve 9 and 10, looking at your soft palate, and testing cranial nerve 12. Your uvula moved with phonation, that's 9 and 10, and 12 is when I had you to move your tongue, that's cranial nerve 12, and there was no fasciculations with movement. The next thing I'm going to look at is your neck. The skin on your neck looks good. There's no scars or lesions noted. I'm gonna feel of your trachea and feel your thyroid. That looks good. Any tenderness noted there?
No.
Okay. I'm gonna feel your carotid arteries. I'm also gonna listen over both carotid arteries for bruise. Hold your breath for me. Alright, you can let it out. The next thing I'm going to do is I'm going to have you touch your range of motion for your neck. So if you can move it one side, other side, move it back, extend, flex forward, and circumduction around. Good. I'm going to ask you to push against my hands with your shoulders. Good, that's testing cranial nerve 11. The next thing I'm going to do is I'm going to look at your chest. I'm looking for symmetry while you're breathing. I'm making sure that you're not breathing hard. There's no tachypnea noted. You're not tripoding. Doesn't look like you're working hard. I'm also looking for symmetry, and it looks like everything looks symmetric. I would also look at the color of your skin on your chest and your back. And then I'm going to go ahead and take a listen, okay? Also noting that there's no deformities noted with your chest. You're just going to listen to all lung fields. I'm going to palpate for tactile firmness. So I want you to say 99, 99, 99, 99. Good. And then I'm going to go ahead and also listen for egophony. So if you'll say E, 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 and then 99, 99, 99, 99, 99, 99, 99. And then I want you to whisper 1, 2, 3 for whisper pectorality. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. Okay. And then I would be looking at your skin on your chest. And or you listen on your chest. So I think I'm going to go ahead and I'm going to listen to your heart while you're sitting up, and then I'll get you to lay back, okay? Okay. And I'm going to listen to the aortic, pulmonic, tricuspid, mitral, and apical. And then I would listen to 60 seconds for your apical pulse. And I would also listen with my bell. 5 spots. And then I'm also going to feel at the maximum point of impulse. I'm going to get you to lay back. And I'm going to listen to you again. I'm going to inspect for any heaves or lifts. I'm going to look at your neck for any jugular vein distension, and there's nothing noted. And then I'm going to move on to your belly. I'm going to look at your belly. Move your arms. I'm going to look at your belly for any abnormalities. I'm going to make sure it looks symmetric and everything. And then I'm just going to go ahead and listen before I feel, okay? I'm going to listen in all 4 quadrants. Vowel sounds are active. Normal and active. And then I'm going to also listen to your aortic, renal and iliac, and femoral pulses. For breweries. And I would listen to the skin. And I would also, or listen on the skin, and I would also inspect your skin on your abdomen as well. Now I'm going to go ahead and feel your belly. Let me know if you have any tenderness, okay? Any tenderness noted? Okay, good. I'm going to go ahead and percuss. And that sounds good. And then I'm going to feel for your spleen and liver. Okay. Now I'm going to set you back up. Okay. The next thing I'm going to look at is your upper extremities. We're going to be testing everything, your strength for all of your extremities and your joints. So the first thing I want to look at is your hands. I'm looking at your capillary refill, and it looks like it is less than 3, which is good. Let me look at your joints. I don't notice any swelling or abnormalities. I'm going to go ahead and have you clench your make a fist and extend out. Can you raise your fingers up, put them down, and then bring them like out, extend them, bring them in, abduct them. Good. Can you do the same with your wrists? Bring them up, bring them down, out, in, around. Okay, and then I'm going to go ahead and do your elbows, out, hyperextend. You bring them all the way down here. Okay, and flexion. Good. And then I'm going to do your shoulders. So extend out, and then bring them back in. And you bring them out, back, hyperextend, and bring them up, forward, and up. Good. And I'm going to go ahead and let you just bring your arms out to your side and push up on your shoulders. Good. And then can you rotate your shoulders? Good. Any pain or abnormalities there? The next thing I'm going to do is I'm going to go ahead and look at your legs, your lower extremities. So I'm going to look at your knees. Any tenderness noted in your legs? Okay. Can you flex your leg out, flex your leg in, do both sides? Good. And then can you do your hips, abduct, and then bring them in too. And then I'm going to let you do against me, push out, push in. Good. And the same thing with your arms. Push out, push in. Good. And then up, and then down. Oh, down. There we go. You're strong. And then, and then, I'm gonna go ahead and test your reflexes, and I would do these bilaterally, but I'm just gonna do one side. I'm gonna do the brachial, and then bicep, and then, oh, just relax, there you go. Relax your arm. Okay, and then I'm gonna do, okay, and I'm gonna do knee. Scoot back so your legs like hang off, there you go. Good, that one was really good. Just relax. Good, and then I'm gonna take your shoe off. While I'm down here, I'm gonna look at your toes. Can you spread your toes apart, put them together? Good. Can you move your ankles? Circle. Can you do your feet up, do your foot down? Point them down. Good. Any tenderness or anything with that? Okay. And I don't notice any swelling or anything there either. I'm gonna also test your vibratory sensations on your wrist and your ankles. You feel that? I'm gonna do it on your ankles. You feel that? Okay, good. And I would do that bilaterally as well, but for time constraint, I'm gonna not do that right now. I'm gonna have you close your eyes, and I'm gonna ask you if you tell me when you feel something and where you feel it.
On my cheek, arm, leg, foot.
Okay, good. And then while your eyes are closed, I'm gonna put something in your hand, and I want you to tell me what it is.
Bobby pin.
Good. And then I'm also gonna draw on your hand to feel.
Circle.
It's a number.
3.
Okay, yeah. And that's just doing your sterogenesis and graphesthesia. The next thing I'm gonna do is I'm gonna have you go ahead and stand up, and I'm gonna look at your knees and your hips while you're standing up as well. So if you could flex or extend your leg out, and then bring it back in, and then extend this leg out and bring it back in, and duck, and then bring it out forward, bring it back in, bring it forward, bring it back in, and then can you go back with it? And then the other one, good. And any problems there, pain, can you move your foot around on both sides? Good. And then can you bend your legs up? Okay, knees look good. And then I'm gonna get you to go ahead and bend over, here, face this way. Bend over and touch your toes. I'm gonna feel your spine, and you do have a little bit of curvature in your spine. And then I'm gonna go ahead and get you to walk a straight line, and just walk that way. And then do heel toe to look at tandem. And your gait is good in tandem. And then I'm gonna have you close your eyes. I'm testing the Romberg, and you're good. You're not swaying or anything, so you can open your eyes back up. I want to get you to hop on one foot for me, and then the other foot. Good. I think the next thing I was going to do is I want to get you to bend over forward, and then go back, and then side. We're just testing. There you go. Testing your back and your hips. And I think that completes this assessment. Thank you.